All right, good afternoon, everyone. Good morning to some. Welcome to this week's edition, Mountain Pacific Quality Health, It's Worth a Shot. Today is August 3rd, and it is the 29th edition of this series. My name is Jessie Kinsey, registered nurse and account manager with Mountain Pacific. Today, we are going to be discussing environmental cleaning and disinfection. Going over some common infection prevention concerns and taking a look at some recent on-site visits and virtual assessments as related to infection control. I think we have a great half hour ahead for you. Next slide, please. As usual, just a few housekeeping items. Any webinar topics or clinician ideas or needs, feel free to add those into the chat, and we'll continue to meet every Wednesday, really through the end of the year and beyond. And we do have a polling question set up as we continue to look at vaccine hesitancy and seeing how we can best align resources and tools to address that barrier as we look at vaccine uptake. So polling question up on the screen for everybody. Have you seen or heard any information about COVID-19 vaccines that you couldn't determine whether it was true or false? Give folks a little bit to answer. Thank you everyone for participating. This helps greatly in identifying needs. All right, well, it looks like a couple more people are checking the poll. So over 50% said yes, it was hard to determine what was true or false when it came to COVID-19 vaccine information. All right, I'm going to end that poll. All right, thank you everybody. Interesting. These polling questions are always very interesting and informative. And again, they help align resources and tools as we address vaccine needs. All right, next slide, please. As always, many thanks to all our participants and partners and guest speakers. Next slide, please. And we did have a couple follow-up questions from last week regarding Novovax. So first one, can the Novovax vaccine be mixed and matched with other vaccines in a series? And the answer is really there's limited evidence available on this at this time. And we're kind of keeping in tune to what information is released, and as more information is made available, we will definitely share that forward. Next slide, please. Question, is Novavax effective against Omicron and its subvariants? And really, the clinical trials were conducted before those variants started to circulate. So the data that we have does not show well what the effectiveness is. However, they did start a new phase in the clinical trials to test boosters and specifically those variants. So as that research and data is made available, again, we will share that forward. And if you guys have any more questions about Novovax, we do have our in-house pharmacist on the line, Kyla, and feel free to throw those questions in chat and we can make sure to follow up on them and answer them for you. Next slide, please. So without further ado, first topic of discussion today, environmental cleaning and disinfection. Does contact time matter? I introduce Crystal Morris, our peer with Mountain Pacific from Wyoming and the senior account manager with Project First Line. Crystal, it's all yours.
Thank you, Jessie. It's always nice to follow you. You have such a sweet demeanor and welcoming voice, so thank you.
You bet.
I've been here a few times introducing Project First Line, which is CDC's Infection Control National Training Collaborative. Today, I'm going to be talking about environmental cleaning and disinfection, but most importantly, why contact time matters. So if you can hop to the next slide, please. So I hope you've all heard of Project First Line and Mountain Pacific's Why First Line infection control texting app. We are featuring CDC's micro-learning sessions. So again, Project First Line is an initiative that identifies the gaps in infection control knowledge, understanding the why behind the trainings, and sharing the best practices in all healthcare settings. So as you can see, this is a video that we played before on our texting app, and due to time constraints, it is 6 minutes long, so I'm not going to play it today, but it will be in the chat function for you to view at your leisure. So do so anytime. But what I'd like to briefly mention about this video is the objectives are to provide an explanation of what contact time is and other forms that might be used, such as dwell time or wet time, ways to link the concept of contact time to the reality of cleaning and disinfection into the workplace, and lastly, the EPA List N, which is a federal registry regarding the effectiveness of disinfectants and the germs they kill. So really quick, if anyone knows or has used the EPA N list, I'd like to hear from you in the chat, if you would. Next slide, Mary. Okay, and I just realized I'm not showing my camera, I'm sorry. So here's a question for you that we're going to ask before we get started on the training. What is the contact time for a Clorox disinfecting wipe? And just to cheat, I'll show you, have this in my desk. I use it to wipe off the keyboard, my phone, what else? The screen, the desk. So again, for this bottle, what's the contact time for disinfection? And we'll give you time to answer that. Do I end the poll, Mary? Okay, so it looks like the majority answered 2 minutes. So the 4% that answered 15 seconds, if you want to go to the next slide. Is 15 seconds. So as I mentioned, the EPA N list was developed as a federal registry regarding the effectiveness of disinfectants and the germs they kill. So as a reminder, be wary of your products. If the product says that it kills SARS-CoV-2, but it doesn't have an EPA registration number, it may or may not be effective. So where did I get this table? Well, I'm going to demonstrate how to use this list in a couple more slides. So Mary, if you want to go to the next slide and end the poll, or maybe that's just on my screen. Okay. So while you can usually judge if something's clean or not, just by looking at it doesn't always work with disinfection. So because the germs are so small for us to see, we can't really judge how something has been disinfected by just looking at it. So that's why following the instructions when you use disinfecting products is so important. So what you need to know from the label is make sure you're using it correctly and read the label. So first of all, I recommend to use disinfectants that are registered with the Environmental Protection Agency, or we know it as the EPA. The EPA is charged with reviewing chemicals used for disinfection to make sure that they're safe and effective. Disinfectants used in healthcare facilities will usually have hospital grade or something similar on the label. Other things you need to know are which surfaces the chemicals can be used on, which germs the chemicals have been proven to kill, and whether the product should be diluted. That means if you have water or another substance added to bring the concentration level down so it's safe to use. And if so, the label should tell you how to do that and what to use. And of course, the label should tell you the contact time, dwell time, or wet time. So next slide, Mary. So we know we want to use disinfecting products at the right times, and we want to use them correctly. So one of the biggest don'ts is don't rush the process. The entire contact time must finish whatever you're disinfecting that can be used again, like shared equipment, or before a patient comes into a room, or after the patient's been discharged. This is a way to be sure the disinfectant has had time to do its job and kill germs. So to save time, and I've seen this many, many times, don't try to dry the surface when it's disinfectant by wiping it by another cloth or blowing on it with your breath. Also, don't blow air on the surface any other way, like using a fan, unless the manufacturer or the product says it's okay to do so. And then lastly, be patient. This is something we're not good at, and especially when we are under pressure to move fast. But again, it's not worth risking spreading the germs. It's too great. And again, following the instructions keep germs from spreading and keep the patients and your coworkers safe. So next slide, Mary. And so again, so I didn't see where anyone had listed it in chat if they've used the end list. I don't see that in here, but if you have, again, I'd like to hear from you. Mary, I'm going to share my screen and I'm going to show the folks on the line how I use the EPA end list. So bear with me. And I am going to bring up, oh good, Erica, thank you. I've used it as such a great tool. I agree. So this is kind of fun, and I'm excited to show it to you. So somebody holler and let me know when they can see my screen.
Yep, we can see it.
So does it say list in advanced search page, disinfectants for coronavirus?
Yes,
Yep.
it does.
Okay, so again, we're going to take this Clorox wipe, which I pulled you in the first part of these slides. And again, I'm cheating. I can't, it's the size, it's smaller than an ant on here. And so really you need your reading glasses. So I'm going to cheat. And I picked, on the EPA registration list, the number is 5813-79. Okay. So that's the number. That's all I need to put in here. I don't need to put that it's a Clorox disinfecting wipe. It's going to know that. So I'm going to submit. So it's going to tell me right here. So this is the number. Yep, that's the number I put in. This is the active ingredient. The product name is a Clorox disinfectant wipe. Yes. The company is Clorox Company, and the contact time is 15 seconds. So if you like, you can export this into a PDF. And hopefully my screen moves. Did it move?
Yes.
Okay, so that's where I got that table that was in the polling question and in the slide. So again, this is a great list to use. Again, it tells you what virus it is listed to kill. It shows you the contact time. It shows you what surface type you can use it on. So this, you can only use it on hard, non-porous surfaces. It shows you can use it in healthcare and institutional and residential facilities. And again, I love the cool thing is that it's only 15 seconds. So a lot of you thought it was 2 minutes. So again, this is a great tool to use. I believe that the link is in chat for you. Okay, Mary, I'll stop sharing and we can bring back up these slides. So go to the next slide, if you will. So here's just a nice tool. This is an audit tool that I like to use. Again, it's just a quick checklist, but what I like about it is that it is the disinfectant actually registered on the EPA N list. That asks you that right off the bat. Was hand hygiene performed before and after? It looks at donning and doffing of PPE. And then again, I love this tool because it all the high touch surfaces that are in a resident or a patient or resident room are on there. So once again, if you subscribe to our Why First Line texting app, you'll remember in the previous episodes of Dr. Abby videos, on average, a nurse touches 912 surfaces in a 12-hour shift. So you can see how vital it is, and you all know how vital it is to keep those surfaces clean and disinfected. So I think I'm at my last slide, Mary, if you want to scooch over there. So think about cleaning and disinfection. It's just like following a recipe. You want to use the right ingredients and you want to use the correct measurements so you can get things clean and disinfected each time and every time. So the takeaways today are using the EPA N list to ensure you're using an approved disinfectant. So you know if it's on that list, it's approved and what the virus or germ it will kill. You want to follow the instructions on the label and which germs it's targeted to kill. And I think I really emphasize don't rush the process because if you do, it could be disastrous. And then again, know your contact time for each cleaner, as not all cleaners are the same. So I think that is, go ahead and, yep, that's it for me. I want to thank you all for listening to me. I hope you learned something new, and I hope that list taught you a new tool to use from here on out. And Jessie, I'll share the screen back with you.
All right, thanks, Crystal. It looks like we did have a question in the chat box. Wondering if you could put in that number to text to join that Wyoming that project.
Yep, and Claire, I can do that if you could put your email in the chat as well for me.
Perfect. Thanks,
Thank you.
Crystal.
You bet.
And then it looks like, Kyla, looks like there is a question from Cindy, or a statement. She said during the CDC call on Novovax that was held, last week, I guess it was stated there should be no mixing and matching of vaccines with Novovax. And she did put in a link to that guidance. So thanks, Cindy. I appreciate that. And then Claire put in her email address. Thanks, Claire. All right, next slide, please. So I'm going to go ahead and screen share as well. All right, so before I dive into the topic I intended to visit about as far as common infection control concerns that we're seeing, I did just want to announce the launch of a new guide that we created, COVID-19 Vaccine Guide for Long-Term Care. And it's about, it's about a 10-page guide, but we have packed a lot of resources into one location for easy access. We have information, general information to defining who is eligible. And we have guidance and resources on how to host conversations with staff when you're talking about the booster vaccine, or maybe common misconceptions or common questions. We also have embedded in here some updated media posters if you're looking for updating maybe some of your signage, resources on conversations with family, again, looking at that misinformation and how to kind of address that. And then I just want to take a moment to say that Alaska recently launched a vaccine hesitancy scenario-based training module. And there is actually continuing education CEUs available through this training module. And I have that link in there too, all around addressing hesitancy. And there's a lot of fast facts built into here and general information about the vaccine and also regulatory guidance. So, and accessing general information about becoming a vaccine provider. Just wanted to take a couple minutes and let you know that we have this launched. It is on our website and it's under the COVID-19 resource tab, and we'll also send this out to the group. So, oh, and one more notation, we do have QR codes that we're adding to our recently launched guides for easy access. That way, if this is printed off and shared with staff, then that's just one more way that staff could maybe scan it and add that link to their phone. So stay tuned for more, but this is one of our recent launches, and we hope that this is a valuable tool for you. Mary, you can go ahead and stop sharing. Or maybe I need to stop sharing. There we go. All right. So just thought we'd take some time and take a look at some common infection control, infection prevention concerns that we're seeing as we look at on-site visits and virtual assessments. Next slide, please. So quick reminder of what, why, and how. So some of you may have experienced or have scheduled infection control assessment and response surveys. Those are those ICARs. Those can be in person or remote. And those are a complimentary service and really designed to assess a healthcare centers or a long-term care community's infection prevention and control practices and help take a look at where there's potential for improvement and address any gaps. With that, on June 13th, there was a couple updates that were snuck into that. And that essentially just reflects updated guidance to take a closer look at work restrictions for healthcare personnel that have COVID infection and exposures and how facilities and centers address that, as well as updated language regarding vaccination, that up-to-date language. Similar to previous updates, you know, the facilitators who conduct these audits, they may decide whether to use the tool, all of it or just pieces of it based on the priorities and the needs of your center. And again, those can be in person or remote. And it's really up to your community on how you want to address those or utilize that service. Now, Mountain Pacific, we try to collaborate where we can, and some of you have probably heard from us as far as referrals to do something similar to those ICARs in some aspects, and that is those hotspot referrals when folks have a COVID outbreak. And we've been doing those either virtual or on-site. So kind of based on those two assessments and what we've been seeing and hearing, I thought we'd take a moment and share those common concerns forward for you guys. Next slide, please. So some assessment trends, concerns with signage. So to be more specific, something that's come up that folks might want to take a closer look at is specific to where you're conducting your testing station for your staff members, for example. You want to make sure that you have clear signage that's designating that as your testing location and that testing is occurring today. What we're seeing is folks have designated testing stations, but there is no signage to communicate that. So just something to take a look at and see if you have appropriate signage in your area. And then we also are seeing where hand hygiene audits where folks are having infection control concerns or COVID-19 outbreaks that, the hand hygiene audits once a quarter, you really need to increase that to meet the immediate need. And then thirdly, PPE compliance audits. Again, there's definitely an opportunity, and we're seeing increased opportunity if your center is an outbreak to make sure you're doing PPE compliance audits. And evaluate access to PPE. And by this, I mean specifically, if you have PPE stations on your unit or area or location or wing, who restocks those? Who restocks them on the weekends? And do individuals know where to obtain that supply to restock it? And proper PPE use when center is an outbreak. Really understanding what is required and making sure that those resources are available. So eye protection is a good example. We've seen a few folks that you want to make sure you have eye protection on when you are in outbreak status. And I will say too that you see some messages in chat here before I get too far ahead of myself. So folks that are in Montana, if you're interested, you can definitely reach out to Erica Baldry for an iCard. These are a complimentary service, and I will insert her email into the chat box for folks. And again, it's a free service. It's offered for the facilities in Montana. Erica would be the contact. And then hand hygiene audit templates and PPE compliance audit forms. Sam, let me see what we can track down and we will bring those back to the table for you. Good question. We'll see what we can share. Anyone on the line that has some great templates or forms they would like to share with the group, feel free to pop those in as well. And it looks like Erica did share some great tools in the chat as well. So let me just put in Erica's, there we go. All right, thank you guys. Next slide, please. So again, just some general assessment trends that we're seeing around testing stations. Not only signage, and I mentioned designated area, that is an important statement. Make sure you have a designated testing station. As we look at mitigating risks of infection and spread of the virus, you want to make sure that you have a testing station that is well set up, that is cleaned properly between use, and you have well-defined areas between dirty and clean. So specifically, if you have your test set up in one spot, that needs to be a designated area for the tests that have yet to be used. And then your other spot of use tests should be your designated dirty area. And that is where you would have tests that are pending to be read, for example. You want to have a clear delineation between your clean area and your dirty areas. And I've seen some centers just have signage that is wipeable to designate that. And again, access to hand hygiene in that testing station. You want to make sure the sink works and the soap dispenser's full, alcohol-based hand sanitizer if that's available. So I want to make sure that's all there. And again, correct cleaning products, kind of in line with Crystal's presentation today. We want to make sure we're using the correct cleaning products, and make sure your infection preventionists and your team are well aware of cleaning products that may be coming in or are being substituted because your routine product isn't available. We have chatted with a few folks that, just mistakenly product was subbed in and they didn't realize that it didn't clean against COVID-19. So yeah, make sure we're checking those as well. Let's see. Next slide, please. And reminder, double check those policies for testing for symptomatic staff. You want to make sure you have a competency in place for staff that are self-testing. There's a lot of folks doing self-testing, and you want to make sure that you get online, and manufacturers have some great resources right now for healthcare providers for those completing self-testing. Binax now has a certificate that you can actually get from the manufacturer website just to make sure you're performing the procedure correctly. And then, there's a lot of confusion still around understanding accommodations for unvaccinated staff. So you want to take a look at that, and if there's questions that we can assist with through our state Ppe or processes that we can look at further, as always, we're here to assist you. All right, next slide, please. So a few resources, and Christina had to run. Thanks, Christina. Any questions, you guys? All right. As always, looks like we have some great resources in the chat box. If you guys come up with anything, feel free to shoot us a message. For those of you that have joined late, this will be recorded. It'll be posted on our website, and then we'll also send it out next week ahead of next week's presentation, along with any resources that have been identified. The evaluation link is in the chat. If you have a few moments and wouldn't mind taking that survey for us, we appreciate it as always. And I believe this concludes this Wednesday's edition of It's Worth a Shot. Thank you, everybody.